Hello, my name is Mandi Travis, and I am a current Master of Science in Nursing student here at Arkansas State University as part of the Family Nurse Practitioner program. My quality improvement project is titled A Local Arkansas Clinic's Abdominal Aortic Aneurysm Screening Rates Compared to the National Average. I was assisted throughout this process by my clinical instructor, Leah Privet, as well as my faculty advisor, Dr. Christopher Jordan. This is the poster that I created as part of the poster presentation section for Create AState. Due to the current circumstances, we are obviously not able to present these actual posters. The following slides are a breakdown of this poster for the purposes of this online format. An abdominal aortic aneurysm, also known as a AAA, is an abnormal dilation of the aorta, causing a bulging out of this area. This can lead to complications, even death, as these can leak or completely rupture. These are considered diagnostic when the aneurysm is greater than 3 centimeters or 1.5 times the original size of the adjacent aorta. Thousands of deaths each year are credited to AAAs, specifically in those 50 to 84 years old. Most of the time, patients are unaware of this aneurysm until it ruptures. When these rupture, there's a burst of blood into the surrounding cavities of the area. The average mortality rate of these is 80%. This picture gives you a comparison of a normal aorta versus one that has an aneurysm. And you can see the bulging out and how wide this area is compared to this area. The highest risk factors for developing a AAA include someone who has ever smoked, making them 3 to 5 times more likely, as well as the male gender, making them 2/3 more likely. In adults, AAAs account for 4 to 5% of sudden death, as well as 8% of all men over the age of 65. All the prior factual information has been highly researched and led the United States Preventive Services Task Force to recommend screening all men 65 years of age who have ever smoked for a AAA using an abdominal ultrasound as preventative care. Based on this recommendation, the purpose of this quality improvement project is focused on comparing the AAA screening rates of men 65 to 75 years old who are current or foreign smokers via ultrasound at a local clinic here in Arkansas to the national average of 9.2%. This is a pie chart showing you the 9.2% ratio of those who are being properly screened versus those that are not being properly screened at the national level. This study was completed with the objective of comparing the ordering of proper screening tests for AAA detection in a local Arkansas clinic for comparison to the national average screening rates in compliance with the USPSTF recommendation. This study was performed to gather information to be synthesized for the overall improvement of compliance and knowledge for the proper screenings for AAAs in a local rural clinic in Arkansas. Prior to researching and gathering data for this quality improvement project, approval was obtained from the Institutional Review Board. The methodology chosen for this project was a retrospective chart review. 50 charts were chosen at random using the electronic health record system at the local clinic. These were charts chosen based on the inclusion and exclusion criteria, including the time frame of January 1st, 2019 to November 1st of 2019. Inclusion criteria includes male, 65 to 75 years old, and a current or former smoker. Exclusion criteria is a female, anybody less than 65 or older than 75 years old, and a never smoker. The overall results of this study concluded that the rate of proper diagnostic screenings at the local clinic in Arkansas was only 4%. This graph shows you the comparison from the national average to that of the local clinic here in Arkansas. As you can see, only 4% here in Arkansas, 9.2% in the nation, but there are also large margins for improvement. The national study also compared imaging methods that also view the aorta, include X-ray, CT, and MRI. These are not part of the recommendation due to the risk related with these tests being used just as a screening method, but if these are included, there is a drastic increase in the number of people with imaging showing the aorta. When including the other imaging methodologies, You increased by 22% at the local level and 41% at the national level. When comparing the results of this study to the national study, the Arkansas clinic completed less than half of that of the national average's screening rates. Regardless of the numbers for either average, there is a desperate need for an increase in compliance for providers across the nation based on these numbers. The overall goal of this study is to bring awareness to the screening rates of the providers for education and encouragement of compliance with the recommended screening practices. As stated prior, there's a high risk of morbidity and mortality with the rupture of a AAA. The ultimate goal is to raise awareness for proper screenings to decrease this rate. An average of 96% of the patients seen in a local clinic are not being screened as recommended. This leaves multiple patients at risk. With an ultrasound being such a low risk for a patient, this screening measure is easily completed for the essential purpose of increasing the quality of life in patients. I hope you enjoyed this presentation. Thank you for your time.